I don't know where you're joining it from, but we have an amazing listening session and amazing presenters. So I am going to, the Let's Lead Academy. It's a program that has been going on for a while at the Perch. We are going to learn very briefly about that. But today we're actually here to talk about Hispanic, Latinx, lived experience, expertise. And here's how the agenda is going to go. We're going to have very brief welcoming remarks for our director, Dr. Sherelle Bellamy. I'm also going to share a little bit about the program, the overview. We are going to hear why Latine lived experience is so critical at this point, but we're here to learn from you. We're here to listen from you, and we want to make sure that as we move forward with this initiative, we get to learn what are your needs so we can better make that dream come true, because I know this is a dream of mine. We're going to be listening to Annette and Christine. They are two Leslie Fellows. They're going to share their experience and journey to us. And then we are going to be breaking out in sessions. And you can select either you want to talk in English, Spanish, or Portuguese. So I know, Lee, you have some polls, so I'm going to stop sharing my screen and turn it over to you.
Yeah, so I see many folks introducing themselves in the chat, and thank you so much. I want to encourage that. It's great for us to see where you're coming from and to see kind of just the sheer amount of folks coming from in different areas, from Colorado. I see some folks from Lowell. So it is wonderful to see everyone. And thank you so much for joining us today. Please feel free to add your name, pronouns, your where you're coming from, your role. We're also going to put that up as a poll now so that folks can let us know. We made it multiple choice. So if you fall under multiple roles, please feel free to add those. But on screen, you'll see what role do you represent, and the choices are certified peer support role, other paid lived experience / expertise, other mental health provider role, and volunteer lived experience expertise role. I will also put that in the chat if there is anyone who can't necessarily see that coming up because of their connection. Let me know if you're having any issues with that. Also, I'm providing technical support. So as well, if there's anything you need throughout today's event, if you're having any issues with connections or being able to view everything, please let me know and I'll be happy to assist you. Awesome. Looking live, it looks like we have a lot of folks coming to us from other mental health provider role, but also very strong representation from paid lived experience and expertise roles. Give some folks a little bit more time to answer that if you haven't had a chance already. But please feel free to let us know. This is fantastic for us to know as we look forward to how we can engage and get folks into this conversation. It's so nice to see folks from the Multnomah County Health Department, DMAS. Welcome, Janice. Welcome, folks who are coming from the MHTTC from New England. Welcome, Carlos, coming all the way from Beaverton, Oregon. Thank you all for joining us. It's so lovely to see so many people from different areas coming to join us today. All right, I'm going to go ahead and end the poll. Hopefully everyone has had a chance to let us know where they come from and what their role is looking like. And I will end that and I will share it out. As you can see, we have a lot of folks coming to us, 23% from certified peer support role, other paid lived experience expertise, that's 39%, 55% other mental health provider role, and then also 23% folks coming from a volunteer lived experience expertise role. So thank you for sharing that with us. This is so valuable for us to have this information as we move forward with Let's Lead. So I am going to turn it back over to Maria.
Thank you, Lee, so much. This is amazing to see the diversity of people that we have today, which is exactly what we need in our Latino and Hispanic communities, because lived experience covers a lot of us in this field. It is my honor and privilege to turn it over to Dr. Sherelle Bellamy. She is the director of She's not only my director, she's also a professor or profesora, as I call her, and she laughed. And she's also my friend. And we together have been working on the Let's Lead Academy for the last 7 or 8 years. I don't remember, please don't tell how long ago we know each other, Shira. So, profesora, bienvenida. Oops. Oops. Is she not able to join us right now? Okay, she may be having some difficulties. I see her, she's off the screen. So not sure what's going on, but let's see when she comes in with somebody else, please let me know. And we talk back to her. So for now, let me share my welcome and appreciation for, okay, is she here? No. Okay.
Her computer just went out and she's trying to get back in and is having trouble getting back in.
Okay, that's okay.
Thank you for that update, Heather.
So I can tell you that today I'm here coming to you from my corazón. Why? This has been a dream of mine to be able to promote lived experience expertise and peer support throughout our Hispanic and Latino. I have served, and I am an immigrant from Colombia, and I've been in this country for many, many years, always working on recovery-oriented care. And my lived experiences inform for many things, especially my cultural values and background and my experiences. I'm also a person with long-term recovery, but I do not represent a role of peer support, but I have dedicated my career to this effort. So for me to have the honor to be joining and co-creating this amazing curriculum and now bring it to the first Latino and Latine Academy is just a dream come true. And all I feel is gratitude. And at this point, I want to invite all of you to, as the song said, it was very selected with a very intention, La Vida es un Carnaval. We are here together to join in partnership to co-create the first Latine Let's Lead Academy. And we want to hear from you as to what are the needs and of which we're very aware. We are all from very diverse backgrounds. We were even having these conversations about how do we go about it? Because there's a Spanish speaker, there's Portuguese speaker among us, there's a lot of diversity, there's countries, people come from here, from there. So we all know we're very diverse, but therefore we want to make sure that we give that voice and be represented across the lived experience world. So what I'm going to share very briefly is what is this academy? We're going to be doing actually an informational session later on, but to do this academy, we have done these academies for a long time. We do this around the world. We also do it locally, and we also do it, we did one in the US. We are also partnered with the New England MHTTC, and we are doing this for this academy. We are partnering with the New England MHTTC. I'm very excited to also be joined for our colleagues in Puerto Rico, from the Center of Excellence of the Hispanic, and I'm making this completely wrong because I haven't learned the name. But we are going to be partnering because we all need to work together on this effort. So what this 9-month academy seeks, just so we are, a little bit about this, is that we look to enroll fellows, as we call them, into a 9-month journey of transformation. And what we do want people to learn about it is how to understand the critical issues in mental health and other systems of care. we teach and we have interactive speakers. And in this case, we're going to create a Latino Hispanic faculty of all walks of life, practice elements of transformational leadership and appreciative inquiry. And then happens for 11 weeks online. And then fellows have 6 months to develop projects. That's what you're going to be hearing about today from Annette and Christine, our fellows, from 2 different cohorts. So it is an intense program in the sense that it's a 9-month commitment. We do have a process. I'm not going to talk about the applications. We do that at the end, and we're going to send information. There's an application process. There's an interview process. We seek to enroll 12 to 14 fellows per semester, per cohort. And then people, as they walk through this journey, think about and create and ignite transformative issues about to create a project in their communities. In this case, the idea is to build alliances among different Hispanic Latina communities in the regions that we're going to be working with. And then there's a graduation follow-up that provides a certificate of the Yale Program in Recovery and Community Health. So I'm going to stop sharing now because I think if Dr. Bellamy has not joined us yet, has she joined us?
Yes,
Not?
I'm here.
Oh, Dr. Bellamy. So I called you Professora before, okay? So I said you are my friend, my colleague. I was just starting to talk about why this is such a dream, but please, go ahead.
Okay, great. First of all, thank you so much. I'm so sorry my computer stopped working. I am Sherelle Bellamy. I'm director of Yale's Program for Recovery and Community Health and a professor. I am a lived experience researcher, and lived experience is central in my work and all that we do at Yale's Program for Recovery and Community Health here at the Department of Psychiatry. It is truly my pleasure to welcome you all today, and thank you for taking this time to be with us today in this space. I'm excited to hear from my colleague, Dr. Janeer Hernandez. We know that he has so much to offer us, and just excited that he is willing to lead and continues to lead in this area. And we're excited that we have Let's Lead fellows and alumni who are here to talk with us today. Both Christine as well as Annette Diaz are here, as well as I see Susanna from Toronto, who's also here with us today. So if there are other people in the room, please be sure to introduce yourself. So thank you so much. And why leadership? We need leadership more so now than ever. We need leaders who can lead with authenticity, people who can get at the pulse of what's happening in our communities and with our, our neighbors and in our neighborhoods. We need people that can lead with conviction. And we need people that can lead with a sense of pulling all of us together, that sense that we are all in this together. And more so than that, we just need lived experience leaders. We need Latine leaders more so than ever. So again, thank you for being here today, and we look forward to hearing from you and learning from you. Thank you.
Thank you, Sherelle. Yes, this is amazing. So without further ado, let me introduce the speaker of the day to set up the stage about why it is so important to do this right now. Dr. Janeer Hernandez. We met in our journey through the TTC world. He is a colleague at the ATTC, which is the New England ATTC Center. And I had just very recently the privilege to hear him once again. I have heard it, and it's just every time, it's just such an amazing honor. So Dr. Janeer, please introduce yourself and go ahead, take it away.
Muchas gracias, Maria, and thank everyone else for joining, for being here today, and willing to engage with us in a conversation about the strengths, the diversity, the need that we have to humanize people and bring people into this process. As was said, my name is Janeer Hernandez. Yo soy de Puerto Rico. I am from Puerto Rico. I have lived in the U.S. since I was 4.5 years old. Just a little bit about myself. I currently live in Massachusetts, and I direct a workforce development program here in Mass for Hispanic, Latine, African American, Black folk who are interested in becoming credentialed in the clinical field of substance use disorders and mental health. In addition to that, I serve as a consultant on a number of federally funded projects at the national level. I won't bore you with a long list of them, but just know that I've had the pleasure of visiting and working in every single state except the state of Alaska. Last week, I just got back from Portland, Oregon, working with some folks there and met some really, really good folk who are working to humanize, to bring services to the Hispanic, Latino, Latine population there. You heard multiple times I was referred to as Dr. Janet Hernandez. That is a title that I have. I prefer that you call me Janet. However, I want to recognize a few things within the title that enabled me to do this work, and hopefully some folk can identify here. Yes, I'm a certified prevention specialist. Yes, I am certified and licensed as an addictions counselor. And yes, I have a PhD, and I also have a GED. And my GED I earned in prison. And it was more challenging to earn a GED in prison than to earn a PhD out here. I am a person in long-term recovery with lived experience, both in the mental health world as well as in substance use disorders. I do not like the fact that we separate out the two. Because many of us live with co-occurring issues that are happening with people, and we need to think about what that means. So I'm a person in long-term recovery, which for me means that I haven't used a drug, including alcohol, for the last 36 years and 10 months. It enables me to be a productive member of my familia, first and foremost, my community, and to be present here with you today. So there's some ground setting that I would like us to do here, right? So you've heard already, some folks saying Hispanic, some of us saying Latino, Latina, Latine, right? And the list goes on and on and on. I really like the fact that many of you in your chat introductions, I'm from Colombia, I'm from Venezuela, I'm from Puerto Rico, I am from, right, these other countries. We are a very diverse group of people living in the US, even though we're lumped together in ways that are many times detrimental to who we are and the strengths that we bring. So just a little bit of ground setting. I know that, eyes glaze over when we talk about statistics, but it's important to bring those into the room. As of July 1st of last year, we're 63 million approximately Hispanics, Latino, Latinx living in the US. Okay? That's a huge number. We're 19.1% of the total population. Again, we're very diverse, and that diversity brings with it strengths, not just in numbers, but in terms of who we are and what we bring to this endeavor. It's important to note that about 13 states have over 1 million Hispanics or Latino Latin residents as of 2022. Those include Arizona, California, Colorado, Florida, Georgia, Illinois, New Jersey, Nuevo Mexico, New York, North Carolina, Pennsylvania, Texas, and Washington. And I'll remind us that some of us did not cross borders, borders crossed us. So when you hear me pronouncing names like California, Colorado, right, once a part of Mexico, those and many other states. And so it's important for us to own that and to explain that. In terms of the challenges that we're facing are many. I'll pick on a few related to mental health and substance use disorders very specifically here in terms of data. And this is from the 2021 National Survey on Drug Use and Health. So approximately 22% of Hispanics and Latin Americans reported having a mental illness. I'm reading very directly and using the terms that they use to address this. So that's 22%. Compared to 23.9% of non-Hispanic whites. Only 36% of Hispanics or Latino receive mental health services compared to non-Hispanic whites at 52%, which means that the other percentage go untreated, right? In the past year, substance use disorder among Hispanic or Latino Americans was 15.7%. Reported rates of illicit drug use was 19.4%, and unmet treatment needs 15%. So those are huge numbers, right? Suicide is the third leading cause of death among Hispanic and Latino Americans, 10 to 24 years old. and men 25 to 34 years old, right? So there's a lot going on there by way of the different issues that we confront and that we see. Now, the literature is filled with data and statistics around disparities, inequities, and punitive approaches. And I bring that into the conversation. We bring that into the conversation to set the stage and the context to listening to you in terms of your experiences and what you think are important and your concerns as well, right? So think about this. We, in the US, we have the largest prison population per capita in the world. It's called mass incarceration. 1970, there were 200,000 people incarcerated. Fast forward to today, that's 2.3 million people. That's 2.3 million families that are impacted by mass incarceration. Every year, as a country, we release 8 million people from local jails, federal prisons, and state prisons. A combination, 8 million people. Most of those people, upwards of 75% of them, will be rearrested within a year. Of those, 50% will do time again in the future. And so they're released with very little support, with very little guidance and resources around reentry. And not just them who are being released, but let us never forget that they are the family members of the people who are being released, right? Because when one member of the family goes to jail, everybody goes to jail. I know that from my own lived experience and my family's lived experience, right? Prisons and jails in the country is the largest mental health provider. Imagine that, the largest mental health provider in the country are prisons and jails. And I know the answer to this, but I'll ask it anyway. If you have a mental health challenge, where do you want to get treated? In the community, in a community-based setting, with people who know and understand you, or do you rather get it treated in a prison or a jail? I think that the former is what we all want, deserve, and need, as well as the people that we work with, right? The numbers say that upwards of 65% of all people incarcerated have a mental health issue. I personally and professionally believe that that number is higher because going to jail impacts everybody's mental health, right? 75% have a diagnosable substance use disorder. In the county where I live here in Massachusetts, 98% of all the young men incarcerated have a diagnosable substance use disorder, according to the sheriff here, right? And I know that you know the data in your own areas. It's important to mention that while other people get treatment, access, quality of care, the approaches directed at us as the Hispanic, Latino, Latine communities, as well as African-American folk, Native American folk, and other people of color have been really punitive. Most of the programs that exist were not designed by us. And the decision to design programs in a very specific way, what does that do? It hinders access and it hinders quality of care. And those are two different things. You can gain access into something and not necessarily have quality of care. Our folks are on the receiving end of lack of access and poor quality of care, right? That leads to what? To dehumanization, to stigma, to deaths by suicide, to opioid overdose deaths that are alive and well in the country. And when we begin to see numbers go down in opioid overdose deaths because of all of the funds and resources that are coming into communities, let us never forget that our numbers continue to go up, right? And so it is important for us to wrap our heads around what has been the response. And to really articulate and understand those. And again, there's plenty of data that's connected to that. Now, there's a documented workforce crisis, and it goes like this: primarily white, primarily female, baby boomers, and retiring. And that's a workforce crisis within behavioral health, very specifically mental health and substance use disorders, right? On the other hand, the client population in need of services, wanting services, is more young and very diverse. And so the Hispanic, Latino, Latine community is an example of that. Our community is very young as compared to other, to the white communities, non-Hispanic white communities in the US, right? And we are very diverse. So there's those two realities that exist within the workforce. SAMHSA, the Substance Abuse and Mental Health Services Administration, estimates that we need approximately 80,000 people right away into our workforce in order to deal with the crisis in the workforce and the demand in services that exists and continues to grow, right? So that's 80,000 people that are needed as we speak. And you know this because most of us don't work exclusively within Hispanic or Latino Latina organizations. We work within other organizations, and we know how challenging it is. You know how challenging it is to get our issues on the agenda, to get a perspective from our communities on the agenda. And we are overworked and underpaid as a workforce as well. So in terms of the peer workforce, very specifically jumping to that, right? What is it that we're charged with doing? We're charged with working with people at the individual level to help them to identify barriers to getting wellness and recovery, remove those barriers, and increasing recovery capital. That's the charge, right? For people with lived experience. Obviously, that includes supporting people, understanding them, leading with empathy. All of those things are extremely important. So what is it that we bring as Hispanic, Latino, Latina folk, right? You know this, we're gonna have a conversation about this and get to hear from you. But I argue, right, that we bring the cultural elements of familismo, of personalismo, of language, of espiritualidad. We bring empathy, we bring a historical context, we bring faces and voices that look like us, that speak like us, not just in English or Spanish, but also Portuguese and a whole bunch of other native languages that are spoken throughout the Americas, you see? So we bring all of that by way of strengths to this endeavor. In terms of the largest explosion in the behavioral health workforce has been in people with lived experience. That has been the largest explosion over the last 10 years because of the focus on peer work, right? And so that explosion brings with it a little bit more diversity, not as much as we would like to see by way of our participation, but it's way more diverse than the existing workforce that's clinical in nature, right? What else do we bring to that endeavor? Contributions, as stated in the literature, for better outcomes. In other words, we, as people with lived experience, when we work with people in collaboration with clinical people and people doing all sorts of work from across the continuum, prevention, intervention, the multiple pathways of recovery, which include treatment and recovery supports, when we work in collaboration with many different people, the outcomes of the people in need of services, in need of recovery, in need of support, in need of humanization, their outcomes continue to get better. And that is not just Haned saying it or the folks who planned this listening session. That is in the literature. Those are outcomes based on evaluations, right? And so we need to lift that up because we bring huge value. We bring huge value to this endeavor. In terms of leadership development and the peer workforce and thinking about the combination of the two, right? So what is it that we need? We bring, again, with us the diversity of the Latina community. We bring representation, including ethnicity. Yet we have to focus on issues of how do we attract and retain younger people into this process, right? Because our workforce is aging out. Listen, I started in this workforce when I was very young. I was in my early 20s, right? And I was, a person who came out of prison, very young. And right now we're thinking about how do we attract people into our field? And we're thinking about, okay, so let's go to colleges and universities. I think that that's a strategy, but not the strategy. If we want to get people excited about our field, we need to begin in middle school and in high school before they decide what they want to be for the rest of their lives by way of a career, right? And there are many of us with lived experience who want to give back. You know, people in recovery, what's the first thing when they enter into recovery, start feeling good about themselves, start engaging with communities of recovery and that sort of thing from all walks of life? What is it that we say? We want to give back. We might not know how or when or where, but that's a thing, because giving back gives us a sense of belonging, a sense of pride, a sense of ownership, a sense of contributing in other people's lives. And that's a huge thing, right? This is not just about training. And a lot of people talk, oh, we need training, we need that. And I agree, but the larger piece is workforce development. How do we develop the workforce? Because training is a part of workforce development, but it's not the whole thing, right? It's not the whole thing. Workforce development includes a number of things, including mentoring. I have been the beneficiary of multiple mentors throughout my life experience that have helped me to get to where I'm at, right? Again, I didn't get here by myself. And I know that all of us in this room didn't get to where we are by ourselves, regardless of lived experience or not. This includes career exploration and career ladders. What do those look like? Not just to bring people in, but how do you explore different careers? How do you grow within the profession, right? All of those things. For some people, not all, they're interested in becoming credentialed, because credentialing opens doors for people. And those credentials enable people to get paid. For those of us who want to be paid and work in the field, there's a group of people who want to work as volunteers, and that's fine too. Credentialing brings with it a lot of things, including training and the knowledge and workforce and everything else that's needed to be able to do this, to be able to do this work. And then what about supervision and support? And how do we provide supervision and support that's grounded in cultural humility, that's grounded in cultural proficiency, that takes into account our lived experience, which is very difficult from doing clinical supervision with professionals in the field. There are many things that are relatable, but this is different. And when we are doing supervision for the Hispanic, Latino, Latine community, that should have its own cultural elements that are attached to it, right? And then what is our responsibility within leadership development to address changes in policies at the federal level, at the state level, at the local level, at the organizational level, so that we continue to build on eliminating disparities and leading with equity. We do a lot of work at the individual level, and that work is important, very important. But we get more bang for the dollar when we work on policies that affect everybody. And we can chew gum and walk at the same time. We should be able to do both, right? And so, you know, I give you, here's who we are. Here are the challenges. Here's what our people are dealing with. Here's the reality in the workforce. And this is what the workforce brings by way of the peer workforce with lived experience in many different ways. And what are some of the challenges that are still left in front of us? There are many. We'd like to hear from you on what those challenges are. But that, you know, I wanted to share that from a very personal place, right? I can teach and do teach courses at the academic level. My place and heart is at the community level, working with people with lived experience, because that's how I was nurtured and brought up. And my mom always told me, we need to do for ourselves, and we need to look out for our familia. And you know this better than I do. Our definition of familia is very different from the traditional role of familia in the US. We need to lead with that level of empathy and caring for our folks. I want to stop there. And thank you for listening. And I'm going to go to the chat and see, because people have been saying some stuff in the chat that I haven't been able to read carefully. Thank you.
Gracias, Hanir. Sí, líderes con pasión, con experiencia de vida, transformación. That's exactly what the Let's Lead Academy does. And we need speech support, certification in other languages like Spanish and Portuguese. So all of this, but the most important thing about this academy, this process we're doing today, is that this is all about working together and co-creating the process together. This is why we have such an amazing partners to do this work, not only in New England, but the National ICEC, and again, the National Center of Excellence. So, okay, now it is my honor to present the most amazing colleagues and fellows from the previous cohorts from the LET. Annette Diaz, she was part of the first cohort when we first started this academy, when we tested the curriculum, when we got funds from SAMHSA to do that many years ago. And then Christine was part of the New England MHTTC cohort. So they can tell you by personal experience what this transformational journey meant to them as Latina, Latino, Latina. We decided not to can get across. So go ahead.
Hi, everyone. Thank you. It's an honor to be here and to be able to speak a little bit about what this meant to me. It was amazing to hear Dr. Haner talk about the percentages of things because that puts things in perspective. I am a Hispanic Latina from Puerto Rico. I've been here for, I don't know, 15, 20 years in the state of Massachusetts. And it's a privilege to work with the community I work with. As Haner was talking, I was thinking about my own lived experience and how my dad being a drug addict and being influenced in that kind of world influenced why I want to help other young people who has family members who are in substance use and are in recovery. That makes me want to help people because at 30 years ago, I had no one to help me and no one noticed what was happening inside of me. I always say that when someone uses any substances in your family, everybody is affected by that. And some people just don't see it. So I am humble to be here with you guys. And I want to talk a little bit about Let's Lead and how that Leadership Academy transformed my leadership abilities. It gave me perspective and strength on serving the community effectively. One of the things I liked the most talking about throughout the academy was talking about transformational leadership. Before the academy, I've had experience with leadership and had a bachelor's degree in business. But once I joined this leadership academy, it opened my eyes of what transformational leadership was really about. It was about inspiring others and sharing common visions for change. It was about empowering and transforming and dedicating to nurturing, other spirits in the community. And when I say spirits, it's not about spirituality, it's about people, but just, being able to give back to the community. Another thing that I loved was my understanding of healing racism and cultural humility. Obviously, in the Hispanic community, Latinx, Latino, a lot of what Haner was talking about talks a little bit about, healing racism. I am a white Hispanic woman, and I don't see maybe what my husband, who is a dark-skinned Puerto Rican, experiences. And one time he mentioned, like, you don't understand. And I wanted to understand so bad, but I was so disconnected to what his perspective was on certain things. So all these teachings throughout the weeks of this academy has really, really dug deep inside to help me understand more than what I already knew, and just be empathetic and be passionate about supporting people in my community. I think it's really important to recognize the biases that you have internally, and then how to be able to help others. So, we talked about compassionate, and being compassionate to others. And, there's so much more that I honestly encourage anyone who's here who has not gone through this academy to join. It's an amazing opportunity. I was able to do a project on peer leadership and how to ensure that people with clinical degrees and other types of degrees understood what that peer leaders were doing, because I think that it was new. Peer leadership was kind of a new thing, and people were not understanding what a peer was going to do. Are they going to take my job? Are they going to, do this or that? And I think with my project, I was able to sit down with a lot of people, licensed clinicians, and kind of talk to them about the peer world and what we were here for and how we can work together to support a person holistically as a whole thing. So it's an honor and privilege to continue to serve our community, and I'm going to pass it on to Annette.
Okay, thank you. Hi, everyone. My name is Annette Diaz, and I'm a person in long-term recovery, and I've been in recovery since 2009. I have also came through the prison system, kind of a little bit of everything here, a variety of a genre. One of the things I do like to stress is that I am a person with the persistent mental illness, so my life is not as easy sometimes, but I stay on task and keep on moving forward. So I got connected to Let's Lead. Backtrack a little bit. I worked for a behavioral health agency in Connecticut, in northeastern Connecticut, and I developed a leadership position there and trying to promote the peer workforce, what it is that we do, just everything around it. And it was extremely challenging and rewarding at the same time because we made a lot of progress and a lot of strides, but also I didn't understand a lot of things that I didn't even know I didn't understand. So when I got connected to Let's Lead, it opened up my eyes in a different perspective. And what I mean by that is like the way the business runs. I'm in recovery, so I'm compassionate and I want to help the world and I wear my heart on my sleeve and all this stuff. And I didn't understand the business perspective. So going through the course, learning, listening, asking questions, and also hearing a lot of the same challenges that I was having and facing, the stigma and, just people not understanding the role. It was like, wow, I'm not the only person going through this. Oh my God, it didn't work.
It didn't work.
Can you hear me?
Yes, we can hear you,
Can you
Annette.
hear me?
Yes, Annette.
Wow, I'm so
Wow, I'm so sorry.
Annette, you need to close your either your phone because
Yep.
we're hearing you double. Okay.
It is.
hold on. All right. So sorry. Are we good? Can you hear me?
You're all good, Annette.
Oh, I am so sorry, everybody. My computer is not being very friendly today with me. Okay, so let me start over. My name is Annette Diaz, and I'm a person in long-term recovery. Yes.
We heard that, Annette. I think we heard some of
so
it.
then what?
Yes, just was
Oh,
the
yes,
last portion of it. If you want to just backtrack a few minutes.
Oh my God. All right, I apologize. So I'll just go back to the where I was at when I learned about Let's Lead, okay, in my workforce development. Ay, Dios mío. Okay, so Let's Lead taught me how to be more professional, okay? Like I said, I really worked on a lot of feelings and giving back, and I needed that support. One of the things that always brought me back is in the recovery movement and the peer community was when there were jobs for people or opportunities, there was never a bilingual required, or, never really was a focus on adding us to the behavioral health system or to the community. So it bothered me a lot, and I had to figure out a strategy and why, and I don't even think we've gotten there yet, so being part of this and trying to continue to move forward and advocate for that pathway for us, because we get left behind, you know what I mean? And so taking these leadership steps and taking the risk and having these uncomfortable conversations with employers or behavioral health agencies or whoever, and to be equal in that, you know, in the hiring and the percentage of, because like I think Dr. Henry said, 36% of people are not even touched with services. So what does that mean? Like, you know, there's still a lot of work that needs to get done. But I do want to promote, if someone in the recovery community has an idea, you know, they want to take the next level and do something, or they just want to learn how to be a little bit more effective in how this whole world works in the peer community. And I would definitely say, put in your application, you know, you're on for a journey and you're on for a ride. And I appreciate you guys. Thanks.
Thank you both. It's just been a truly honor. And as I think as we in our LET team always said, we always learn and grow from each other. So now is the fun part. We're here to actually hear from you, talk to you about your needs. We had asked, there's an option of 3 languages. We'll do 3 breakout sessions if you want, 1 in English, Spanish, and Portuguese. The presenters will co-lead. We will co-lead the different ones. So I think I'm going to turn it over to Lee. In interest of time, we just want to be very transparent. There's going to be a poll as I talk. We initially scheduled this for until 2:15, and then realized that's wasn't going to be enough time for a conversation. So what we're going to try to do, hopefully we are, thank you for all the speakers to going a tiempo. We're going to talk to you for 15 minutes in the small groups. Then each of the facilitators will present back to the group. What we want to hear is the application is out, and we'll talk about that at the end. But we want to hear what are your needs, because again, we believe in co-designing. As this is our first Latine Yale LET Academy, we want to be able to be inclusive, hear everybody's voices. And then therefore, both Annette, Christine, and myself will be in different rooms, and then Graciela and Mark for Portuguese. So please select a choice of the breakout sessions you want to leave. And then we'll see each other, and we'll do a 15-minute breakout session.
Thank you, Maria. Yeah, so if anyone hasn't had a chance to put either English, Spanish, or Portuguese, their choices, please feel free to select that, and then we will go into the breakout rooms based on those decisions.
Oh.
Just wanted to make sure we gave folks enough time to answer that poll, and then to go ahead and we'll start those breakout rooms.
Thank you so much, Lee. And I think both Hannah and Annette will go to the English one. I will go into the Spanish one with Christine. And then we have Portuguese, Graciela.
Awesome.
And I think it's Mark. Okay, thank you.
Okay. All right. I am going to create the breakout rooms. And we're going to have 3 breakout rooms. And folks are already divided into the ones that they chose. If there's anyone who needs to be moved, please let me know. I'll stay in the main room, and I'll be here to assist if you have anything that you need. But right now I will open the breakout rooms. As you're coming back from the breakout rooms, we'll just give folks a little bit more time to come back and join us. And then we'll do a quick little overview of all the fantastic conversations you had in the breakouts. I hope that it was fantastic. Okay, it looks like everybody should be back. So I will turn it back over to Maria.
Gracias. Thank you, Lee. Yes, well, I don't know about en nuestro cuarto de español hablamos muy interesante. Entonces, in interest of time, let's just keep the reports back very quickly. I'm going to start with the English group. At least one highlight from everything. We're going to really take all this account, all this feedback to incorporate it, but something that resonated, that was highlighted. Please go ahead. I don't know, Hannah or Annette.
I think they may still be in their breakout room. They'll be back.
I'm here, but
oh,
probably has a better.
Annette is here.
I was muted. I was talking to myself once again. I do that about 3 times a day. So apologies. Yeah, we had a lively conversation. We were able to get at the 3 questions. So I must say that. And a lot of things came up by way of strengths, including, people who've worked for decades in the field and they're still willing to learn and work, being a person who identifies as Latina, and that's a huge strength. Cultural awareness, advocacy, lived experience is the strength, prison experience, ability to speak more than 1 language, and to slow down languages so that people can better understand them. History of surviving trauma, advocacy to reduce and eliminate barriers, lived experience as a strength, and we are hardworking. So the work ethic of the community is there. In terms of what's working well, lived experience, there's some things that came up there. More awareness about pathways of recovery and the services, confidence of people in recovery to do the work, ability, confidence, and self-esteem, familia, and a sense thereof of familia, representation in programs, more elected officials who understand us and get what we're doing. There's greater representation within agencies. Advocacy is something that's working well, and more access created by and led by peers. In terms of recommendations for what we need to do even better, it's expand the idea that we are an extended family by way of connection and how we lead with empathy, more focus on the undocumented populations, more advocacy is needed, living wage and benefits for the workforce. We need to lead with equity. We need fairness and equity in hiring, promotion, and retention of workers. Those are some of the things that came up.
Gracias, Janet. Christine, de nuestro grupo en español.
Yes, so a lot of similarities. I think obviously Aner was able to kind of say it more eloquently, but a lot of the strengths that we bring is our language, our culture, being able to be so diverse in being Latino and Hispanic. We bring food, we bring different dialects, and one of the things that most we talked about was family, and family also includes like friends that become family, and so we talked a little bit about that. What's going well, one of the things that touched me in that conversation is that recovery, being able to share your recovery openly. I think people had stigma about that years ago, and right now I think people have been more okay with sharing, so that was great. Being sympathetic and empathetic, and things that we need to improve is being okay with change, and advocating for change. And something's not working or something is working, trying new things to see if that can be improved. More things in Spanish for people with low levels of English or people who have disabilities, and then training for supervisors who are supervising people with lived experience. Those are some of the things that we said.
Gracias, Christine. Yo también estuve muy touched con la cantidad, like Janer said, la cantidad de valores que traemos a este trabajo. Bueno, Gracie, en portugués. Gracie?
Yeah, sure. First
Okay.
of all, yes, thank you, Maria. First of all, it's a huge pleasure. My heart is in party right now because we have Brazilians here, so thank you all. So something that we discuss is related what was said here, but the importance to address lived experience in trauma, immigration trauma, the experience to build the life sense of belong, how you create opportunities here. So at the same time that we are resilient people, you keep moving, you keep trying, we're able to build a life and grow from our experience and share the journey, the recovery journey that each one of us is going through. So in terms of what the recommendations, continue to share information in Portuguese, create material in Portuguese, talk to the community and send out information, create maybe small videos in Portuguese. Say that is the opportunity that we have. So, and what is working well, there is a couple of things that work well. If you have a few peer supporters that speaks Portuguese, we know you have peoples and works that it's doing a kind of peer support work, connect with the community, keep them informed, engage these Brazilian people with the community they live, help them to grow, share their journey, talk about stigma, inform about services to address lack of access to information, needs of have more provides, and the big role the peer support for Brazilian communities really to help them to access, grow, and learn about how to navigate in America's system of care, education, well-being, job, however. So there is a huge, huge need and gap to have peer supports who speak Portuguese in this country. Thank you.
Thank you, Gracie. So now let me just turn it back to a little bit about next steps, which I think is really what some of you are hoping to kind of get a sense today. So let me just put this thing like right now here. So as let me just share this again. From current slide. So again, this is a 9-month program that's going to be starting in January. So applications are now open. This will be the first Hispanic Latino Lead Experience and Peer Support Leadership Academy. All of the applications can be found, and I think Cherie and Lee and others had already put it on the chat, and I did myself, are on the website. At PERCH, which is the Yale Program for Recovery and Community Health, which is here in this slide. And you will have access to this slide when we send our follow-up email to people. So there are 2 ways to complete the application. One is to download a PDF, and you will need to email it to Cherie Brack. And the other one is to use a link that's going to bring you to a Google form that actually has the same questions in there. And you can just complete that and submit that. So if that's easier for you, you can do that. Applications can be completed in any language if you want, but the applications are in there in English. But if needed, there are 3 people you can reach out to provide support, and apologies about this. The first, again, is Cherie Brack. The second one is Graciela Reed for Portuguese questions. And if you have en español, me pueden contactar a mí. We will stay tuned for an informational session. We unfortunately just dawned on me, we need to do if you have more questions about the Let's Lead Academy more in depth, the purpose for today was really to get a sense and build it based on your feedback and input, and really taking into account the amazing need, as Dr. Haner pointed out to us. But we probably will very soon, and we will advertising an informational session. You can reach out to anybody, any of us, if you have questions about it, but we will do it through the New England Mental Health TTC and the Center of Excellence. We'll have an informational session if people have more questions about the academy in itself, like, more details of it. This was not intended to do a depth overview, but just to create momentum and to really invite you to participate in this amazing effort that we are completely confident that this is going to grow, and this is going to expand and represent nuestra voz, nuestro liderazgo en todos los espacios. Entonces, I'm going to really turn it over to, again, I don't know, Dr. Bellamy, just to thank our amazing Dr. Haner speaking, Christine Isiari, and Annette Diaz for coming us for some final words of thank you, gratitud, gracias, en portugués, gracias.
No, first of all, I just want to
Obrigada.
Gracias.
just want to just thank you, Maria, for just being an excellent partner over these years and developing and leading Let's Lead. It is with your leadership as a lived experience leader that this project has grown, and we're now in our 10th cohort. And I do want to acknowledge all of the work that you continue to do for not only the Latina community, but also for other Black and Brown communities and others as well. So thank you for that. And just again, thank you, Hanir, even though he said I'm still gonna call you a doctor just because I appreciate that there's so few of us that are here today that could actually stand up and be recognized as such. So thank you for all that you do. And thank you again, Christine Irizarry and Annette Diaz, again, for your continued work that you're doing and your leadership in the community. Thank you, Cherie. Thank you, Janice Tandora. Thank you, Eric, and our partners at the National Latino Center on Excellence. I'm very excited of the work that you all are going to be doing nationally to really move forward the workforce development and leadership of Latina, Hispanic, and Latinos. So thank you so much.
It's time for the
Bravo,
Latinx
bravo. So, well, Janet, thank you. Gracias. De corazón. We're staying tuned. We continue to look for details and do not hesitate to contact any of us. We'll probably then send a follow-up email to everybody, but if we don't receive it, just reach out to any of us. Ok, muchas gracias a todos, una feliz tarde, me encanta verlos, conocerlos, obrigada.